there's the robotic voice. Okay, so now we are heading into some introductions. So now that we finished the housekeeping items, I would like to take this time to briefly introduce you to the Healthy Aging Alberta initiative and the Core Alberta platform, so for those who might not be familiar. So Healthy Aging Alberta is a by community for community provincial initiative that brings together a rich network of community-based organizations from across the province that are united by the vision of making Alberta one of the best places in the world to grow older. So Healthy Aging Alberta focuses on the development of a coordinated community-based senior serving sector that is respected and integrated within the broader senior system of care and can empower and inspire every senior to age how they choose, ultimately improving health and social outcomes for older adults. So there are thousands of incredible organizations in our sector, each offering critical services that support healthy and empowered aging, but we can be stronger together and have a louder voice when united. So together we can create a bedrock for healthy aging in our province by building a network that connects the sector's organizations. Healthy Aging Alberta seeks to develop a coordinated sector by bringing together community-based organizations around a common framework for action with a focus on identifying and addressing priority areas related to healthy aging in community. So this initiative seeks to create a provincial network of organizations that can advocate for healthy aging on a provincial level, share knowledge, and create functional relationships with one another and our allies in health and other sectors. Like a tapestry, we become stronger when we weave our knowledge, expertise, and passion together. United, we can create more communities where older Albertans are supported as they grow older in their homes and engaged in their communities, a future we all want and can benefit from. And one of the tools at our disposal to support the weaving of this network is Core Alberta. So Core Alberta is a sector development tool that has been developed to support the collective vision and strategic objectives of Healthy Aging Alberta. The Core Alberta platform is a free member-based digital knowledge and learning hub designed to support provincial sector coordination and strengthening by connecting community-based senior serving organizations to one another and their allied partners. Core Alberta provides a digital space to share knowledge and capacity building opportunities, allowing members to find and collaborate with one another and their aligned mandates. Our core groups, like our core elder abuse group hosting this event today, is an example of creating learning opportunities that bring organizations from all across the province. We have over 1,000 members and are growing each and every day with more and more individuals like yourselves contributing to this knowledge hub. And so we would like to thank you for being with us today. And with that being said, we have an amazing guest speaker here with us today to share their knowledge and experience. So I will now hand it over to Charlene, one of our core elder abuse group leads, to introduce herself as well as our guest speaker.
Thanks, Cindy. Hi, everybody. Thanks for joining us today. My name is Charlene Sitar, and I'm the Regional Elder Abuse Prevention Coordinator for the Yellowhead Elder Abuse Response Network. And it's my privilege to introduce our guest speaker today, Dr. Donna Wilson. Dr. Wilson is a registered nurse with a full-time tenured position as a professor in the Faculty of Nursing at the University of Alberta, and her education and experience is truly phenomenal. Donna's program of research focuses on health services and health policy, primarily in relation to aging, ageism, and end-of-life care, including bereavement. Much of her work is oriented to myth-busting, with the aim of eliminating ageism and ensuring effective and accessible healthcare services for older and also younger people. She has over 350 published articles, books, book chapters, and other peer-reviewed communications in print. She's frequently and widely consulted for her expert commentary on aging, end-of-life care, bereavement, health policy, healthcare services, and health system trends and issues. And welcome, Dr. Wilson, to our session today. And thank you so much for agreeing to do this presentation for us. And that said, I will give it to you.
Well, how wonderful. I really feel privileged to be here today. I'm always totally excited when I'm asked to give a talk, and especially on something that I have a great deal of passion for. And I think I'm talking to other people as well too that know quite a bit on this topic and have some good information to share. And anyway, let me just get my slideshow. There we go, from the beginning. So what I'm hoping to do is sometimes talk about some controversial things, certainly get a discussion going. Because when you have an active group talking about things, that's when, you know, people sort of get motivated to do something maybe for themselves or their organization or whatever. So again, what I'm trying to do really with this introduction is to say, please feel free to put information in the chat. When my PowerPoint is open as it is now, I can't see what's in the chat, but the moderators are watching. And certainly put your hand up and talk during this presentation, or save a question to the end if you like. But I'll move fairly quickly over quite a number of things. And so it's a good idea to jump in if you've got some thoughts, if you disagree, or if you'd like to add to what is here today. But again, I feel really privileged. And I really thank the group for organizing this, and for all of you for what you do around aging and stigma and assumptions about frail elderly people. So let's get into this. It's pretty obvious now that we have population aging in Canada and of Alberta, where we're sitting. But what's really interesting is some of the research that I've done to try to trace back, you know, when did we start getting kind of concerned about population aging? When did we sort of notice it? It was about 100 years ago in Canada, and actually it was the Spanish flu. Right around that time, and believe it or not, in the health and magazines and, you know, the scientific literature at that time, they were talking about, oh my goodness, young people were dying for the first time of infections, and we're getting population aging. And by the way, all that clean air and water and, you know, TB control and what have you is allowing people to become very old. So the concern around an old, you know, old people aging and population aging, it's been around at least for 100 years in Canada. But what happened really was the 2016 census is what really kind of brought out kind of a current spark in attention. And that was because of something called accelerated population aging. And that census of Canada, of Canadians, identified this massive, major socio-demographic trend. And really what it was that they found people aged 65 and older for the first time ever in Canadian history outnumbered children aged 0 to 14. And they started doing estimates then, and oh my goodness, in 2030, which is not that many years from now, the baby boomers, that big, huge, massive cohort of children that were all born right after the war, the 20 years after when the vets came home, including me and maybe a few others in the group. When that big group of people, many of them who are living to age 65 and older, somewhere between 25 and 30% of Canadians will be older. And that honestly has scared a lot of governments, a lot of organizations. It has really raised a lot of attention. Now, if you're wondering why I haven't put a more clear figure in there, I guess it depends. Are you an optimist or a pessimist? Is it 25 or 30? So this is, I guess, where we really start getting into kind of ageism. You know, should we fear this population aging or not? Now, so although it's obvious we've got population aging, it's not at all obvious about what we should do about ageism, which is actually two things. It's a negative personal perspective that you can have about old people and about aging yourself, fear for your own self. But it's also the larger kind of social government reaction to a greater proportion of the public being old or very old. Now, when I first started going to university to learn about aging and why do we age and what have you, at that point in time, actually, anyone 80 years of age and over was considered very old. And now it's very commonly considered that if you're 85 and over, then you should be classified as the very old. But it's possible that at some point that is going to change as well, too. And perhaps the reason I'm interested in aging is I had a 90-year-old grandmother that I couldn't keep up with. And many of you maybe have had wonderful role models, or perhaps you've had the opposite. You've had people in your lives that have made you think about, my goodness, it's really tough to be old and it's not so great to be old. So anyway, I'm just kind of laying the groundwork for what we'll get into much later. But so in some ways, ageism isn't just about negative personal and bigger kind of reactions to more people getting old or very old. But the reality is it means a much larger number of people. And when you think that we only have 7,000 hospital beds, we've got about 14,000 nursing home beds, et cetera, numbers really start to matter. And this is where, again, there gets to be some great concerns. And in fact, in the Edmonton Journal today, there was a big article about do we have enough hospital beds in Alberta compared to other places? So numbers matter, size matters, as we know. Okay, so this was what Cora asked me to talk about, busting myths around frailty and inaccurate information about aging, looking at building resistance, personal resistance, and maybe organizational resistance and resilience as well too. So building our capacity to live with an aging population, to live with our aging selves, and to look specifically at aging, frailty, and elder abuse. And I did come up with some objectives which, get at stigmas and definitions and highlight where there are issues in policies and practices. But really, I want to emphasize throughout this that there are two main types of ageism: that personal, inward-focused ageism, and the much bigger kind of ageism that is out there. So I'm going to talk really about those two as we go. Now, I hope I encourage you to talk, and I often I ask my nursing students two questions. So here's the first one. How many of you think that you will live to be 100 years, or maybe even more than 100 years of age, or close to it? So it'd be lovely if I could put out a poll there and find out, what proportion of this. Now, when I first started nursing, teaching nursing students, not a single hand went up. Now about half of the hands go up. So it tells you that in 30 years, things have really changed around the idea about, is it even possible to live to be 100 years? But it is also good to maybe possibly live that long. So what's the reality? Well, the baby boomers, let's come back to them, a very, very unique cohort. And there's been a lot of attention to the baby boomers simply because they were just so massive and they tended to change everything. But when you look at the baby boomers, they were the first group that really, a lot of them finished high school, went to college, university, maybe a few times, best education, but the best income as well too. They had the best food of any previous cohort, safety and security. The baby boomers have never lived through a war. And they've also had the best health care of any previous cohort or generation, including vaccines and antibiotics. So actually a much larger proportion of the baby boomers will live to be 100 years of age or close to it. And the guesstimate is about 10%, whereas it's maybe, 1% if we're really kind of lucky. But the reality is, and I go to these scientific conferences around the world and that, especially around biological aging conferences, is that with science, and other developments, social developments. Now, most people in developed countries could live to be 100 or perhaps even 120, which is considered the human lifespan boundary. You know, there's talk sometimes that people live past 120, but typically it's never verified. The issue, though, it's also possible now with climate change, this pandemic, but even bigger and more serious issues such as widespread childhood and adult obesity, and some other issues that a reduction in life expectancy will occur. And in fact, we're already starting to see that in Canada because we've had this pandemic for 2 years and it's impacted life expectancy. Now, the interesting thing with life expectancy is you look at that and you go, oh, gee, only 82 years, 80 for males and 84 for females. Well, no. That is if you were born in 2019. And in fact, we're going to do some we're going to maybe look at how old we will kind of live. And by the way, I'm going to keep putting in sources of where I got this information if you want to look this up for your own use. So here, Statistics Canada puts out these wonderful, what's called an age pyramid. And if you look at there's quite a pronounced kind of little bump. If you look at the blue line, that was, if you look at that pronounced bump for both males and females, that was the baby boom generation, just a massive group of people that, were all kind of born over 20 years. They all went to school, all kind of went to university, all went into the workforce kind of around the same time. And now about half of them are retired. And of course, then we sort of wonder what's going to happen then as they age, because the yellow now, 20 years later, shows where that group is. So Stats Canada has wonderful information. Of course, this is all built around the census that's every 5 years. But anyway, so if you're wondering how long are you going to live, well, there's lots of calculators out there that you can go online. And in fact, there's one that's a Canadian one, and there's the website for it. And there's only 9 questions. And the strange thing is, when I found this about 5 years ago, I did it, and it estimated I was going to live to be 84 years of age. And I did it just this week, and I'm now going to live to be 89 years of age. So this might be a good one. It's given me 5 extra years of life. But anyway, it's very, very brief. So probably not that accurate. It looks at what's your current age. Are you male or female? What's your family history, height, weight, do you smoke? Interestingly enough, have you had a driving accident? And what's your blood pressure and your alcohol consumption? Now, there's many other kind of longer and maybe more accurate ones that ask similar questions, sometimes different questions, like how much do you exercise and whatever. But you have to think about, first and foremost, do you want to have this longevity estimate for yourself? So, because remember, aging, it's a lot of personal feelings around, would you kind of really like to know when your end date is? And, I talked to my daughter and I told her, gee, honey, I just did this. And it looks like I'll live to be 84. And she burst out crying. So, whereas I was thinking, hey, that's great. That's pretty good. In fact, I'm going to beat that. That was what I thought, with getting this estimate. So anyway, here's probably the more important question. And again, I ask nursing students this: do you want to live to be 100 years of age or over? And this is really something maybe that, would be a great dinner conversation where you've got friends and family over and you really start to probe this and start to realize how common ageism is, or maybe how pronounced it is that people are starting to have different views about old people and aging. Because again, this is really where we explore ageism. Now, what thoughts come to mind when you think about age or old, or old people? In other words, what images maybe come to mind as well too? And these are some possible images, if you just take a look at them. Actually quite common images. In fact, they've given these a name. So if you look at these 4 images of old people, well, they're known as the 4 Ds. And so it's of 4 Ds of old age: dementia, depression, disability, and death. And of course, death in hospital and death with suffering and what have you. And actually, I've been doing some research on that, and only 44% of deaths now take place in hospital. Most people are electing to stay home in the nursing home or stay at home or whatever. So actually, there's when we start to look at inaccuracies, there's lots of inaccuracies, but these typically are always the images that come to mind. Now, on the other hand, I'm curious, how many of you now can look at these images? Traveling, exercising, maybe dating, finding a new companion, working, having fun at work, meeting new people through work, having fun with grandkids, being meaningful and helpful to grandkids. Do these images come to mind? And I'm going to come back to actually some of the statistics around what is real, and especially now in Canada. Because really the reality is that most people are afraid that as they age, they will become ill, they will become disabled, they'll be dependent on others. They, of course, will be senile, confused, Alzheimer's, whatever. They'll be powerless without influence. They will be victimized. They will be abused, and they will be poor. These are very common leading up to now, and I'm hoping that they're less and less over time. But even today, these are very common fears about getting old. Now, we do know that even now, these fears are justified in some cases, but typically it's because we know of one sad case. And in fact, just last week, I was in at my dentist, and of course, there's your mouth open and the dent, he knows I do research on aging and whatever. And he's telling me about his grandmother. So of course, all old people fall and, break their hip, and all old people, are sad, and depressed and what have you, and all old because of one individual. And it sounded like she just had a really tough time. And, but again, it's considered the norm. And we really see this in hospital as well, too. Because if you ask emergency doctors and nurses, you'll say, what's the proportion of people who come in that are old? And they say, oh, they're all old. The reality is 95% of people who go into emergency departments in Alberta are under the age of 65. They remember the 5%, but they forget the 95%. It's shocking. And it's the same with hospitals as well, too. Research I've done and others have done. If you, on who's admitted to hospital and spends some time in hospital, hospitals are full of old people. 80% of the people who are admitted each year to hospital in Alberta and just about anywhere else in Canada are under the age of 65. And yet we have these persistent myths. We tend to look at the one individual who stands out, and we kind of build the whole prototype around them. Now, the thing is, a lot of this is just without thinking or knowing. You just, you haven't looked into aging, and what the heck? But sometimes ageism is done with very deliberate intent by people or groups who choose to use this to their own benefit or their organization's benefit or whatever. And the sad thing is that ageism is probably the most common and the most overlooked, and also so the widest accepted form of discrimination today. I mean, we know we're doing a lot more about abuse of young women and Indigenous people, abuse and discrimination and whatever. So ageism by far is really the most widespread concern today. Now, why do we age? Well, this is why I'm going to a conference, hopefully, over in France in a few months' time, or it'll be online again. Because really they keep studying, why do cells actually age? So the millions and millions of cells that make us up. Well, really what they find is that the cells age. And there's an accumulation of this molecular, so within the cell and the cellular damage over time. But the World Health Organization makes it very, very clear that these changes aren't sort of like systematic. They're very loosely tied to a person's age in years. And it's not just our cells that age, but there are other factors that really influence how we feel about aging, and what sometimes can even give us jumps in aging. And that is big life transitions like retirement, the death of friends and spouses and partners, and relocating to a different place, moving out of a home where you raised children, and then your spouse died and you realize the house is too big. That's massive change when you look at that. And again, it really does something to the person's psyche and what have you. So in other words, there's physical, social, psychological, and other impacts or developments that over time will impact how and when a person ages. And in fact, we sort of think that the day you turn 65 is when this happens. The research is now pointing out that even when you're in the womb, some of these aging actually effects, cellular effects, actually begin to start then. And it was the Vietnam War that pointed out, and it's very sad, but autopsies of the young vets who passed away in the Vietnam War, that they found how advanced aging was in a lot of these young men. That in fact, you don't turn 65 and these things happen. It's an accumulation over time. Now, what's really evident as well too, if we think about aging as a tree, all of us start out in the womb where we need very common things. We need a good blood supply that brings rich nutrients, and so we're born healthy. Some of us aren't born healthy though, but we tend to need the same things as a child. We need caring people, we need food, we need education, what have you. It's after that our lives really start to differ. And some of that is just good luck, I mean, are we born to families that feed us well and look after us well and what have you? Are we in accidents? Did we catch a fever, and did we get antibiotics in time? So again, as we age, we tend to become more and more and more diverse. And so looking at cookie cutter approaches tend not to work, because what one older person needs and looks like and everything and wants is very different from what another older person needs, looks, and wants. Now, just again, to get into this, because I want to lead into what is considered the frail elderly. So senescence is the name of this biological aging. And it's not just, eventually a loss of some cells, but it's a loss of functioning cells. So the cells over time lose the ability to divide, grow, repair, what have you. And there's where we get into the frail elderly. Is typically people who the cellular aging has advanced to a point where if you meet 3 or more of the following criteria, you could be diagnosed as being a frail elderly person. And in fact, Freed, back in 20 years ago, 21 years ago, published this paper, and it was one of the first really looking at who really should be identified as the frail elderly, so we can maybe prevent this from happening, but also look at who is frail elderly and what can we do to maybe help them. So these typically are people with unintentional weight loss. They've lost 10 kilos in the last 5 years, and they can't explain it. They're eating or they say they're eating the same, what have you. These are people that tend to be tired though. They just have no energy. They tend to be weak. They tend to have a slow walking speed, and they also do very little physical activity. So if you think of the instrumental activities of daily living, these are people. This is the first real sign that people are basically having trouble looking after the house and the housework and getting groceries and what have you. And that study in Free, which has been kind of replicated quite a few times, pointed out that about 6.9% of the community living population of older people could perhaps be diagnosed as a frail elderly person. So these are people not in a nursing home. 6.9% of people who are living in the community. And of course, it increases with age. It's greater than in women than men. But typically, that's because women are older, and it's associated with lower education, lower income, poor long-term health. These are people that maybe when they were 20 or 30 were not well. When they were 40 or 50, they had heart attacks, what have you. And they also tend to have more chronic illnesses. They're a diabetic and they have asthma. They tend to have diseases which have impacted their health. And unfortunately as well too, these are the people that tend to fall. They tend to need more and more help to stay in the home. They tend to be hospitalized more often, and certainly they're at high risk of death. So it's an important subgroup to look at and to consider. And in fact, I was looking at who's the oldest person in the world, a woman, not surprising. January 3rd, she turned 119 in Japan. And her great-granddaughter's wish for her is, I hope you'll continue to live cheerfully into the fullest. But again, again, someone I guess is very vibrant or whatever, but you can see she's in a wheelchair and she exhibits some of what we commonly consider to be the frail elderly. So that she kind of has the look. Okay, now what's interesting about old age frailty is that there now is a lot of attention to reversing it. So it's important to know what caused the frailty. And so there's some really good research pointing out that sometimes it's these what's called the tea and toast diet, which is very common to low income older people who live alone, where you get up and you have tea and toast in the morning. And then for lunch, well, I don't have to cook a meal for anyone, so I'll have some tea and toast. And, it's quick, it's easy, it's cheap, and it becomes a pattern. And so what you've got is low protein, low vitamins, etc. But also what can set off frailty is the death of a beloved spouse or child. And some of the research I've done is just very, very sad, pointing out the impact of, losing the will to live really because of this. And you're lonely and, all the rest of it. But also quite often, and I just lost an uncle too, died at 90 after he fell and fractured his finger or his hip, and he never came back from it. So he had to go through massive surgery. And of course, it isn't just a quick fix. You don't just get up the next day and start walking. This tends to have really long-term health impacts and requirements on him. But really, what's sad about frailty is sometimes it's because of an undiagnosed illness or a poorly managed health condition, or maybe even poorly managed multiple health conditions, which have had a progressive effect on the body and sometimes the will to live. If you feel pretty crummy from the time that you're, retired, it may be early, it may be age 55 or 60 or whatever, that really, if you don't feel well, that really reduces the will to live. And then when if you start losing children and, friends and family, and this is why the pandemic has been so tough on some people as well, too. If you can't get out, even just have incidental discussions with people that you meet at the bus stop or, in the grocery store, if you're scurrying away from people with your mask on from other people around you, it really, really, I'm worried that we may have a jump in frail elderly people. So this is really good research, though, on looking at what's causing frailty, because let's look at prevent it and reverse it. So how can we stop it from going on? Now, let's jump in. Okay, unless there's any questions or whatever. There's lots of tests now of ageism because it's been such a concern for about 40, 50 years that ageism was getting really serious and negative. And the World Health Organization has 6 questions. So if you want a quickie, you can do that. But there are more longer and more comprehensive tests of aging. And there was a systematic review that was done. And of the 11 good, well-developed comprehensive tests of ageism, they picked one. They thought one was the best. And I want to show it to you. It started out with 38 questions, and then they realized about 12 of them are really good. So let's try it out. Now, as you can see, there's 12 questions. The first 4 deal with what do you think about physical health? The next 4 is your mental, social, emotional health. And the third one is about mental health, being able to think and reason and what have you. So you're supposed to go through this and score yourself 1. You think, oh yeah, definitely that's true. 2, maybe it's true a little bit. Maybe it's false, or definitely false, and give yourself a score. So let's just kind of quickly go through this. When people get older, they need to lower their expectations of how healthy they will be. The human body is like a car. When it gets old, it gets worn out. Having aches and pains is an accepted part of aging. Number 4, every year that people age, their energy levels go down a little more. Again, all about physical. Let's look at the next 4. I expect that as I get older, I will spend less time with friends and family. Being lonely is something that happens when people get old. As people get older, they worry more. It's normal to be depressed when you are old. And I expect when I get older, I will, that's the next one. Sorry. So those 4, again, were grouped around your mental, so your sort of emotional, social health. Now the next ones, again, are getting into probably what a lot of people fear as they get older, that I'll get forgetful. I'll stop remembering names. It's natural to get forgetful as you get older, and it's impossible to escape that. But as I get old, I'll get kind of feeble-minded. So really, that was if you look at that, if you went definitely false, definitely false, definitely false, you would actually pass this test. But it demonstrates again, because there are people who will argue absolutely. Of course, when you get old, you get frail and forgetful and, et cetera, like my dentist. So anyway, here's one I think I like better though. This was done by a long-term aging researcher down in the States. And he came up with these 20 questions, which he actually tested out with Canadians and Americans. And he said, okay, you're older now. Have you ever had any of these experiences? Has this ever happened to you? So think yourself. I don't care how old you are. But have you ever been told a joke that pokes fun at old people? Yes, no. Were you ever sent a birthday card that pokes fun at old people? Were you ignored or not taken seriously because of your age or because you looked older? I was called an insulting name related to my age, like you're an old turkey or who knows what. I was patronized or talked down to because of my age. I was refused rental housing because of my age. I had difficulty getting a loan because of my age. I was denied a job promotion or a position of leadership because of my age. I was rejected as unattractive because of my age. I was treated with less dignity and respect. A waiter or waitress ignored me because I was an old person. Of course, I could wait, I was retired. A doctor or nurse assumed that my ailments were just because I was old. I was denied medical treatment because of my age. Remember, they never wanted to give heart transplants to people 80 and over. That's changed. I was denied employment because of my age. I was denied a promotion. Someone assumed that I couldn't hear well because of my age. Someone assumed that I was just daft. I couldn't understand something because of my age. Or someone even told me, ah, you're too old for that. My house was victimized because of my age, and I was victimized by a criminal because of my age. So, I mean, when you think this was really based on what this researcher was finding was really common with aging. And in fact, in the research that he did, that there were 4 of the very, almost everybody had this experience that once you get old and you begin to look older, you had been told a joke that poked fun at old people. You were sent a birthday card that poked fun at old people. I was ignored or not taken seriously because I looked old, and I was treated with less dignity and respect because of my age. Imagine having that happening to you, how much that reinforces, I mean, it puts you down. It's tough to live with that on a daily basis. And in fact, I went down to my local dollar store as one close by, and I looked at all the cards they had for older people. And was sure, and here it was, an old turkey. Sure, you're getting a little older, but you can still shake a leg. On the second page was, well, the alternative is you live in the ground. So if you can imagine getting that on your birthday, perhaps when you turn 65 or 70, 75, 80 or whatever, what we're doing is we're telling older people how they should be feeling, what they should be doing, what they should be expecting. These are very educational. These can really be very disturbing for older people. Here's another one. The internet is so fascinating. And you see the grandchild, oh, well, that's the microwave. That's not the internet. Here's another one as well, too, that I had to show, which is 10 ways to tell you you're over the hill. When people ask you what your favorite food is and you say soft, when you keep repeating yourself, it takes a couple of tries to get over a speed bump, as if you're in a wheelchair. You think libido is an Italian pasta, because of course we know old people never have sex, never want to have sex, etc. And you keep repeating yourself. And on the second page, the inside page, you keep repeating yourself, and there are a few other things. They kind of hit at all of the myths then. But again, these really, if these cards exist and you've got a grandchild buying them for their grandparent, this is what they begin to expect of their grandparent. Really, really disturbing to see these kinds of birthday cards that are thought to be benign, and they're anything but benign. Now, that brings me just into very quickly talking about abuse. We really don't know how widespread abuse of older people in Canada is. The government of Canada got some people, to do a review of all of the evidence and the sources down at the bottom. But the estimates are about half of all people, once they reach the age of 65 and over, are abused in one way or another. I think that's probably grossly underestimated, and I'll tell you why in a minute. We do know that there are common types of abuse, but what we don't realize is that actually neglect of older people is much more common. That's social, emotional neglect of older people. We've got older people living at home alone who never get calls, or maybe they get a brief call from their, the kids that have moved to California or whatever. Maybe they get a brief, call on Sunday or something like that. And the issue, with our what's called the beanpole families, where there's less and less children, and such where people, move so much, and as older people age and their friends start passing away or moving away and they lose contact, is that we know that neglect of older people is really rampant and very concerning. But let's talk about the more common ones that we think about. Financial abuse. That is the most common one, where money is borrowed or taken from older people. But it can also be physical violence, whatever, it can be sexual, and really in all other ways that people can abuse. Older people tend to be a target because it's like, oh, well, they'll be weaker, they'll be easier to grab a purse off of. They're forgetful. They won't know that they gave me $100 or $1,000 and I never paid it back. It's obvious that abuse can be carried out by strangers who sometimes deliberately target older people, or sometimes they're just going after anybody. But actually, more often, and what's more disturbing about this is typically it's family members and friends that they know, grandma's living alone now that grandpa's gone, and he was the banker, the financial management, and so grandma's got lots of money. And she'll leave it to me someday. So I need it now. So I'll take all their money now. The why we think it's so underreported is because older people tend to be embarrassed and they don't talk about it. And they don't want to, send their grandchild to jail or what have you. But oftentimes they're also prevented from reporting it. When sometimes, find that an older person no longer has a telephone. Well, guess what? It isn't because it saved $25 a month. It's so that they can't report. And the sad thing as well, too, is if they do go and report it, they may not be believed or even have it acted on if they do report it. So we have some big issues around abuse of older people. And one of the things I'm looking into right now is, all those phone calls that you get. So if you have a home phone and a cell phone, you're getting all these calls and you think, oh, that looks like my daughter's phoning or friend or the doctor's office or whatever. And you click on it and you say hello. And sometimes you may say a few more words into it. Hello, is anyone there? There now is voice recognition software that if you're an older person, they will click you onto someone then that will phone you and phone you and phone you to try and scam you and to find out where do you live and whatever. So, so one of the things again is being very careful, set up answering machines where you've got that kind of automatic, who knows what age, instead of saying, hi, I'm not home, where again, you identify yourself as an older person. So we need a lot more work around prevention of abuse. Now, why do we think ageism is more apparent now? Why are we noticing it more? Well, some of it again is, kind of why we've got population aging. We've got a rising median age. And a lot of it is because people are living longer, but we're noticing it because we have less kids. There's a low birth rate, and there has been for many years. And because again, if you remember back to that 2016 census that came out saying, oh my goodness, there's more older people than young people. Who's going to work? Who's going to pay into a pension plan? And if you remember the Canada pension plan, there were big discussions about would it collapse? Because there's going to be so many people taking money out of that's a very stable pension plan. It's never going to collapse. But also then you start to think about, okay, if we're not going to be able to fill jobs and, there won't be nurses and doctors and, garbage people to pick up the garbage and do all those other essential jobs, well, we better immigrate. We better have immigrants. And in fact, for quite a number of years, the target has been in Canada to bring in at least 1 million young people every 3 years. Hopefully, these are people that already have children or they're likely to have children for the good of Canada, because now we've got workers. These are people who will work and fill in those jobs, because of course we automatically know that when you turn 60, you're going to quit work and, jump on the pension. Well, I'll get to that in a minute. What's interesting was that 2016 census already found that about 22% of Canadians were born in another country. And they estimate it'll go up to about 30% with either this census or the next census. And so not only is it younger people that are increasingly multicultural, but older people tend to also be increasingly multicultural, not always speaking English well. And this feeds into ageism. But one of the big issues why perhaps even ageism is growing in Canada is because of media reporting. When all you hear in the media about is this terrible burden, this greater burden, and it's getting bigger and bigger, and it's going to be endless. We're going to have more and more burden. Oh my goodness, we're going to have hospitals full of old people, and young people won't be able to get in. We'll have to build more hospitals. We'll have to build more nursing homes. Oh my goodness, family caregivers are going to be burnt out. More and more young people won't be able to work because they're caring for old people. Oh my goodness, we need more home care staff, pension. And there may be other concerns that you can easily identify. I mean, all you have to do is open the newspaper and watch the news in the morning or the evening, the TV news, and you get this fears about the burden of caring for older people. And so that's what I'm going to get into now. These are myths by and large. So again, just to really emphasize that we really have population aging, but we're really in Canada, it's really only about 17%. We're a very young country compared to other countries, and we can look at what other countries are doing. They are not collapsing. Alberta, of course, has always been the youngest province, and that means that we haven't had much time or need to even think about population aging or ageism. So Alberta, in some ways, is behind what maybe some of the other provinces have done, in reaction to aging and what have you. And by the way, people are aging everywhere in Canada, even in the north. So just that kind of thing. And what goes along with aging, of course, is that, well, we kind of know when people retire, they're pretty probably healthy. And in fact, that's why the people between the age of 65 and 74, they call that the active stage of aging. You're active. These are the people that go out and climb mountains because they've been busy at work and, they didn't have time up till now and they want to challenge themselves. These are the ones that build log cabins and travel the world and what have you. Well, that age group in Canada has doubled in that 30-year period. The next group, which is called the stable age of older people between the age of 75 and 84, tripled in number in Canada over that same period. Now, this is the age where typically they're considered healthy. They kind of stay at home. They've done all the traveling they want to do. And this is when their kids and grandkids get very happy with them because they're home and they can babysit. And when you hit the ditch, these are the ones that come and pick you up and get you to work and what have you. It's the age 85 and above, which is called the very old or frail elderly stage. That number has quadrupled in number. And in fact, right now, if you look at census numbers, about 13,000 Canadians are 100 years of age and over. If you give 13,000, and they, again, that number is going to keep, and we'll get into, are these in nursing homes or not in a second. But anyway, can you imagine being the Prime Minister of Canada who used to sign 100-year-old certificates? Even my grandmother, when she turned 90, got the, I forget which Prime Minister personally signed, and the Premier personally signed kind of a congratulations, you reached 90. Can you imagine how tired Trudeau's fan must be as signing off? It must be a stamp by now or what have you. But again, the reality is a lot of us are reaching that. And it's not because we've been sick all of our life, it's because we've been healthy. And all of the conditions are helping us to live to be older. And in fact, you know, more and more of us will get to be very old. That's what this chart shows. Now, talking about COVID, if you don't mind as well, too, we've had just over 30,000 deaths in Canada because of COVID, with 61% of those aged 80 and above. What we found with each wave is the average age has been dropping and dropping and dropping and dropping. And we know that the first wave, the vast majority of deaths were in people because of very vulnerable health, living in nursing homes, and to some degree the staff who were working, with people in a nursing home. We only have a bit more than 14,000 nursing home beds in Alberta compared to about 7,000 hospital beds. And we sometimes had the perception again that, well, these nursing home residents, when they got sick, well, of course they would have gone to hospital. The reality is very, very few of them did. Almost none of them got moved into intensive care unit. And you can kind of think, gosh, that's very ageist. But when you go into nursing home, typically you are at the end of life. And many of the personal advance directives, or even, the care plans that are set up with families, just say, look, let nature take its course, don't hospitalize. So really, if you look at who has been hospitalized and who has been in an ICU, it's typically people 70 years of age, and that is getting younger and younger and younger. And just yesterday, I heard that there was a 5-year-old who passed away in Alberta. Our first really young case of due to COVID. Now, where does ageism fit into this, though? When this pandemic hit, particularly in that first wave, there was a lot of discussion about, well, it's time for them to go. It's kind of course, people in nursing homes, or high users of hospitals, kind of a drain on society, we don't want to have to build more nursing homes, and they're suffering. So this is just really nice, actually, that, that age group was targeted. But again, as I pointed out earlier, who goes into hospitals in Alberta are typically under the age of 65 and going into an emergency room. And in fact, the most common reason to go into a hospital in Alberta is pregnancy related. The reality is that only about 3 to 4% of all old people in Canada ever end up in a nursing home. And the reality is if you go into a nursing home, it is not free. Currently in Alberta, you pay anywhere from $58 to $71 a day. And that's the resident cost, so you're not paying for home insurance and taxes and whatever. So it's the resident cost of staying in a nursing home. So really, when you think of the misconceptions, of people, there's a lot of them out there. And sometimes information is needed to say, hey, that is not true. That is not the case. Only 3 to 4% of all older people in Alberta or anywhere else in Canada will ever go into a nursing home. Ever, ever, ever. The rest of them will be at home. And in fact, there's the proof. Again, High came out, the number one reason for hospitalization in Canada is giving birth. Well, I don't know how many 80-year-olds that are giving birth. So, and what's interesting as well, too, is people will say, well, people in nursing homes got the vaccine first. So that means there's no ageism. Well, the reason why they might have gotten that is because some governments were embarrassed about nursing home design. And in fact, there's big movements across Canada to look at, you know, single rooms in nursing homes and enough staffing and what have you. Nursing home operators got concerned about being sued. And public health officials were unsuccessful in their efforts in the beginning to keep COVID out of nursing homes. Now, I really believe most nursing homes are really quite fabulous for what they do. When you think of who moves into a nursing home, they need a lot of care and attention, they need specialists and what have you. And it was just really bad luck in some ways that this nursing home had a high death rate, whereas that one didn't. It just depended on whether the person coming in the door had COVID and whether it was spread, because again, these are very, very vulnerable people. So certainly there's some better nursing homes than others, but by and large, you know, they have a tough job and they really try to do well. What's some realities then? Let's talk about the really great stuff. Canadians are great world travelers, and often people travel is very, very common up to the age of 80, because that is when health insurance rates skyrocket. And if you want to try and get that changed, please do that before I turn 80, because I want to keep traveling. I don't want to spend huge sums. Because really 80-year-olds don't tend to have a lot of health issues when they go south to get into better weather for the winter. The reality is many new relationships begin after people retire after age 65, and even marriages, sometimes for the first time, but more likely the second or third time, as I'm finding with my friends. And in fact, after retirement, people have time to exercise and they get out more and they get in better shape sometimes than they've been for many years. Because the reality is, it's only about 16% of Canadians meet that sweat exercise guideline of 150 minutes a week. Grandparents are critically important to grandchildren. They're role models, family historians. They do help out with money. They often put kids through university. And about 1/3 of all children in Canada depend on grandparents for babysitting, whether it's occasional or even full-time. And the Vanier Institute has a good report on how many grandparents there are and what their ages are and what have you. When you think about a grandparent, typically is a grandparent for around 20 years, maybe 25 years on average. Grandparents have a huge impact on our society. They have a huge impact on the grandchildren and how they think about aging and what they do, and you know, all the rest of it. Grandparents, we forget how important they are. They are very, very important. Now, here's another thing as well. To grandparents, are they sick? No. And in fact, what they're doing is over time, they're comparing reports of how healthy grandparents and older people, how old they feel. And actually 77% of grandparents, when there was the last good survey, rated their health as good, very good, or excellent. And that was quite a jump from a few years before. And less than a quarter said their health was fair or poor, and that's dropping. And in fact, now, if you look at all the research, typically it's as many as 90% of older people say my health is great. Oh yeah, I have diabetes, but I've lived with diabetes all my life. I've got that under control. I've got a good doctor. I'm, you know, a nurse practitioner or whatever. I'm healthy, or I'm very healthy. And so let's again look at some statistics in terms of dementia. All old people and whatever. Well, it's actually only a little bit more than 500,000 people. If you go into the Alzheimer's Society of Canada, their current reports, that's only about 1.5% of Canadians. And in fact, I mean, really, we're looking at 50-year-olds and 60-year-olds So it isn't like you turn 65 and then you become one of those 1.5% of Canadians. In terms of depression, it's a 1 in 10 rate in Canada, and that's all ages. That's not age 65 and above. And in fact, depression is the leading disability cause for people in the age of 15 to 44. It's, you know, really, if you live to be 65, you tend to be very resilient. You tend not to do, you tend to avoid things that maybe get you down, and you know what to do when you maybe have a bad day or what have you. In terms of disability, oh, we all know we're going to get disabled. Well, look at what's considered disability. And this is the Public Health Agency of Canada. Ooh, you live with hypertension. Well, that doesn't disable you. You take a pill, for heaven's sakes. Half of people have dental disease. Well, maybe we need a dental plan, you know. Over a third of them have arthritis. Well, so what? It wrecks, you know, my golf game isn't quite as good as it was or whatever. And of course, it increases with aging. Um, okay. And the research that I have done really is that more and more and more people are reaching age 65. And in fact, we're up and walking until the last 3 days of life, and the vast majority of people. So when we begin to look at these disabilities or what have you, goodness, here's a little bit more. Even the World Health Organization is like, oh, it's really common now. Hearing loss. Well, not the hearing loss doesn't kill a lot of people. From cataracts, we can fix that. Refractive error, we can get glasses. Neck and back pain, arthritis. Now here's where we get into some other things like COPD, diabetes, depression, dementia. But again, the statistics, you know, when you look at Canada versus other countries, you know, Canada's a pretty good place to age. And of course, they go, oh, gee, and, you know, the World Health Organization is saying, oh, my goodness, yeah, and you can have, you know, geriatric syndrome, a failure to thrive, and frailty, and what have you. Again, a lot of this in some ways is fear-mongering, and part of this is trying to get governments to act, and act in good ways, and maybe to spur organizations as well, too, to support older people and what have you. The reality, though, is private healthcare probably isn't the way to go. Private healthcare doesn't shorten wait lists, doesn't fix issues, but we see the zombie coming up time and time again because we think old people are high users of hospitals. Oh, and they have money, they can pay for it. We think private businesses are better than those public hospitals. And when we get free market philosophies with private rich people and rich companies saying, hey, I want to jump in to that, you know, because in the States, they make so much money off fearful people. Let's jump into that. So we tend to get this, you know, private healthcare, you know, really can be pushed when we've got private, when we've got concerns about aging. The reality is very few people can actually afford to pay out of pocket regardless of age. Private insurance companies don't want to insure older people, anybody with a diagnosed health problem or anybody with an ill family member. And private healthcare typically means you get tests you don't need and maybe even treatments you don't need because it's the profit. The public system becomes a dumping ground, and the public system becomes a poor system if it's not for everyone there. So really, you know, private healthcare systems or mixed private public are not the way to go with an aging population. Now let's talk just quickly about work. We often think old people don't work. Well, that is increasingly more and more and more inaccurate. We find the median, the average age of retirement is going, and it's significantly going up every 1 year every 5 years, which is just a massive change. 20% of people who are 65 years of age and over work now. And it's estimated that by the time the baby boom generation is gone, that will be at least double that. and self-employed people retire later in life. And when you think about it, why do people work longer in life? And me included, I'm after age 65. Do you like work? You're good at work. You started a career later in life. You started a business later in life. You need to pay for a new home, support kids going through university. You're healthy. You want to work. Why not? And you're asked to keep working by employers. And many also are working in voluntary capacities, including caring for ill family members. And of course, older people, whether they work or not, they pay taxes. So, so really, we get, again, a lot of these myths around old people and aging. So just in what I want to do to think about, okay, what do we do now? How do we reduce aging? Well, number one, we know that this is a really good time to do things because societal views of aging old people are changing. There are more positive views that are emerging. When you've got a grandmother that you can't keep up with, you're going to develop a fairly healthy view of aging, as I did. And we've got more and more of that. We've got a lot more evidence coming out that older people are healthy, they're active, they're working, they're climbing mountains, et cetera, And we've got the Charter of Rights and Freedoms, which hasn't been has used enough to show that you should never hire or promote based on age and a few other things like that. We've got more and more age-friendly businesses and more age-friendly community initiatives and practices emerging. And we've got a lot more people that are saying, hey, I want to live to be 100. And so I'm going to watch how much liquor I drink, and I'm going to quit smoking, and I'm going to, I might not turn into a super athlete, but I'm going to walk my neighbor every day around the block. And so we see a lot more people doing things because they want to contribute to what's called successful aging. And we're starting to see where policies around pension plans, aging in place, working, doing nothing, where really we've got a lot of groups that are working on trying to get better government policies and organizational policies and what have you. We're already seeing these changes occurring, so more older people can age in place in their own community. We've got some good developments around pensions and, you keep paying into a pension, et cetera, et cetera. So, but what do you do personally about ageism? Well, first of all, don't accept it. If you don't like the birthday card you get, just kind of say, you know, why don't you get the, why don't you keep this one and find something else? So draw attention to it when you see it. Advocate for yourself, because then you're also advocating for others, and join groups or start groups that advocate for change. Lobby government, lobby organizations for improvements. Teach friends and family to notice ageism and to not accept it. But number one, think about, are you happy with yourself, particularly if it's an aging self? If you're not happy, what can you do? And if you're happy, what can you do to sustain that? Because you are the important person here. Thinking about, again, are you, will you enjoy your retirement years? Will those be happy and fulfilling years for you? Those are very, very important. So in conclusion, and hoped I finished about 15 minutes early so we can have some chats or discussion or whatever. We are going to more and more experience population aging because we already have accelerated population aging now. And by the way, this aging trend isn't just happening in Canada, it's happening in every developed and developing countries. And one reason why it's happening in developing countries is because their young kids are coming here to work. And so they're having that outflow of young people. Canada and just about every other country in the world is being impacted by population aging. And in some ways, we're all differing in our reactions to and our planning for this big shift that's happening. So I've made a very important prediction ageism is going to either get better or worse. Was that for being definitive? But what I do think is going to happen is that the future should be and likely be what we want it to be. If we have a will, there's a way. If we have a vision that we want to beat ageism, that it isn't the most common and overlooked prejudice, we can do that. It's a good time. And there's lots of good initiatives now. So I'm going to stop the share, if it's okay then. And if you need to run back to work or whatever, it's been lovely talking with you. I can't thank you enough and the organizers for organizing this. And I hope this has raised some controversial thoughts or given you some good ammunition to work on ageism. So I'll stop the share there.
Thanks, Donna. We actually have some questions that were in the chats, but I'll let Amanda share some of those.
Terrific.
Yes, thank you so much, Donna. Appreciate. It was a great. I'm just going to put my. Seem to be. I don't have my video on. There we go.
Excellent.
Yeah, so I do have some comments and some questions. So I'll just start in the beginning when you were talking about some of the issues with ageism. Mary had made a question about that mental health seems to be missing. And so do you have any thoughts on that? I know you'd mentioned some things later on about it, but if you want to just maybe expand on that.
Yeah, and when in terms of mental health, so, you know, and again, sorry, I kind of tried to cover so much of everything that I didn't get a chance to talk. One of the things that I've actually spent quite a bit of time on is what's called social isolation. And, you know, as being something, it was noticed first in England. And they have done a lot to try and prevent older people living alone at home, totally, you know, nobody's talking to them and what have you. And so in terms of mental health, oh, and yes, definitely this PowerPoint will be shared with anybody who send me an email or ask the organizers, and this will be. So in terms of mental health, older people really are at risk. That's very, very, very clear. The reality is, though, older people tend to be very resilient. And the statistics now, again, is one of that statistics where I put up, well, who's really depressed? Typically, it's from the age of 40. You know, it's in the years where you're supposed to be happy. And when you look at who's committing suicide, it's typically young adults, people who have not learned to deal with, you know, challenges in life and disappointments in life and whatever. But there are some really big challenges in older age. And like my husband died 2 years ago. And up until then, I had no idea how tough it was to really be bereaved. So I volunteered, you know, I don't plan to remarry again, who knows, but I got in rescue dogs. Now I know a whole bunch of people because of these dogs. I know my neighbors because now I'm walking dogs. And I know the rescue people and what have you, because I knew that I could really kind of mentally go downhill because of my grief and social isolation. I lost a lot of good friends, you know, because they were his friends and our friends and what have you. So I don't know, that's a long answer, but really when you become old, you don't have to become depressed and confused and what have you. Those are myths. And again, older people have tremendous strengths. When you think of how many of them lived through, you know, good friends passing away and, you know, changing from, you know, lots of money when I was retired, and now I'm living on a pension. Amazing people. The older people tend to be very, very wise, very, you know, and that's a stereotype, but, you know, again, just amazing people. They've lived, they've learned a lot.
Thank you so much. So next we have Rose had put, I think there is self-perception as well as cultural factors. What we define or categorize as it's frail in the Western world, is that the same in other cultures or places?
Yeah. Wonderful question, Rose. Thanks. There has been quite a lot of looking at whether culture affects aging, and some of that, of course, is because of this, our Indigenous peoples that really valued elders. And in fact, the term elderly in Canada has stuck around, whereas in England, you couldn't call an older person an elder. That's a no-no, but they don't have the history, our Indigenous people history from Canada. The research that's been done on who becomes a frail elderly person and, an older person with this frailty syndrome, that's been done in many, many countries. And so it's biological aging. Now, of course, that can differ though. Do you eat rice all of your life or are you a potato eater? As I have an Irish background, so your culture certainly can affect, do you eat a high fat diet? Do you, are you living in a country where there's a lot of fast food and it's cheap and easy and it's everywhere, so culture certainly matters and in many different ways. But that biological aging, that's pretty well around the world. But certainly how we age, is impacted by what we eat and do we have access, to vaccines and healthy air and water and all the rest of it. Fabulous. I don't know if that kind of addressed your point or not, but
Thank you so much. So we've got the next question is Norma. She said, doctors seem to think that as soon as you get to 65, you need to take lots of medicine. How much medicine is too much?
Yeah. Big issue. There's actually quite a lot of research pointing out what's called polypharmacy, that you take a pill and it has side effects or it doesn't do the job. So then you get another pill to fix the side effects or because the first one isn't working, and it kind of tends to snowball. And some people as well too, they don't feel that they got their money's worth at the doctor's office unless they came home with a prescription. Like, I'm feeling crummy, I want you to fix it. Give me a pill, give me a prescription. And that pretty well, if you're taking 4 or more medications a day, that would be considered polypharmacy, because the problem is then they start maybe interacting with each other. And the side effects as well too. A friend of mine just started on a lipid pill. Their cholesterol was high. And one of the side effects is forgetfulness. And she all of a sudden freaked out and was calling me and saying, I forgot something today. I said, what pills are you on? She, well, 3 months ago, I started on a lipid pill. I said, maybe you want to go back and there's other lipid pills, maybe without that side effect. And also one of the big issues is once you get on a pill, it's kind of, you're on it for life. And try it for a year and see, because you and I are now exercising and you've cut all the fat out of your diet. Maybe you don't need that pill in a year's time. So, yes, it is very common to get prescriptions, but I'm also going to say something very negative about our fee-for-service, how doctors are paid. And most doctors in Alberta are paid fee-for-service. When you're trying to get a lot of customers through the door, because you've got to pay for your office and, you don't have a pension plan, you have to create your own, save money for your own pension retirement. You tend to want to get a lot of customers through the door, each person who can be billed. Well, the fastest way to get somebody, a happy customer out is to give them a prescription, which they may or may not fill, they may or may not use, they may or may not even need, or a diagnostic test, a requisite for a diagnostic test. And that is a huge issue, particularly for older people. because you know, again, it's you know, the fee for service is not set up for a thorough assessment of older people and to talk to you and find out, well, the issue is you've got a tea and toast diet, you know, because you're living alone, you're low income, and that's not going to be fixed by a pill. You know, it's fixed by, you know, going to a community center once a day, maybe for a good meal with other people. So the pandemic has really set us back a lot. It's created some real challenges.
Well, thank you so much, Donna. There is a few more questions, but Cindy did put your information in the chat box. So if anybody wants to chat with Donna after our session, I'm going to now pass it over to Charlene to just wrap up the session, and just because we're getting to lunchtime. So thanks. Here you go, Sharon. Thanks, Donna.
Thank
Yeah,
you.
thanks so much, Amanda, for that. I just want to wrap up by, first of all, thanking Dr. Wilson so much for joining us today. You have been a plethora of information and might I say, a wonderful role model as well, professionally as well as just as we are all journeying towards an older age every day. So thank you so much for everything. So much information here, and yes, questions. I know that there were more. So thanks so much, Dr. Wilson, and perhaps we can have you back again sometime. Awesome.
I'd love that. Thank you.
Excellent.
And again, thanks to the organizers and thanks for everybody out there. It's been lovely.
Thanks so much. Would like to invite anyone who's part of this session today to join in on other sessions that we have moving forward. And if you're involved in the elder abuse world in the province or addressing elder abuse, to connect with someone on our team to be part of our elder abuse prevention team within CORE Alberta. That said, Cindy, I will pass it over to you now.
Awesome. So I won't take up too much time, but thank you for joining us today. I've left the survey link in the chat. Hopefully you can fill that out and help us know what you enjoyed about today. And as mentioned before, this is the third session in the Core Frailty series, so we would love to have you at our upcoming sessions hosted by our other core groups. I'll leave the link in the chat, but it's also available on CORE Alberta. But yeah, that's pretty much all I have. So thank you so much for joining us today, and hope you have a good lunch. I'll stop the recording also.